This is the Berman Method Podcast featuring Dr. Jake Berman and physician assistant Jenni Berman. We are here to treat problems and not symptoms. Disclaimer, this podcast is for entertainment purposes only and not to treat anyone or to give medical advice. If you are interested in any information that we are giving and would like to use this for yourself, we recommend that you contact your primary care physician or reach out to us and ask us questions about yourself specifically. Enjoy. Welcome to the Berman Method Podcast, where we are focused on treating problems and not symptoms. I am Jenni Berman, physician assistant. I do not have Jake here with me today, Dr. Jake Berman. He is not here, but I do have a very special guest who I am thrilled to have on the podcast, Dr. Nathan Morris. So thank you, Dr. Morris, for joining us today.
No problem. Glad to be here. Thank you for having me, Jenni.
Absolutely. So Dr. Nathan Morris is the Chief Medical Officer of Atrium Innovations Pro Brands. He resides in Monument, Colorado, where he has a multidisciplinary functional medicine practice, Good Medicine Colorado, who focuses on making the complex simple. Dr. Morris is certified by the Institute of Functional Medicine and has practiced root cause medicine for well over a decade. He is actively involved in the evolution of pure genomics, which he envisioned and co-created with Kelly Heim, PhD. Dr. Morris is excited for the future of personalization and its evolution as it empowers patients to understand their uniqueness and strengths. So we correlate a lot, and we are focused on treating the problem of these patients, treating problems of our clients, and really trying to figure out the root cause as opposed to just trying to treat the symptoms or just handing out medication. So really excited to have you on the podcast today. Thank you for joining us.
Thank you, Jenni.
And this is a perfect time out in Colorado, probably.
Oh my goodness. Yeah, I got up this morning. It was 50 degrees, and I don't know, all the people in the South, and they've been burning up and everywhere else. I kind of feel guilty this summer. We've had the best of summers. So yeah, we've seen maybe 90 once. So it's been nice.
Oh man, yeah. And down here in Southwest Florida, we see 98 months out of the year, it seems like. So, well, thank you for joining us. So tell us a little bit about your practice. I know you said you've practiced for over a decade as far as functional medicine goes. So tell me a little bit more about your individual practice now.
Yeah, it's actually been, I thought about it, it's probably 15 years now that I've been doing it. And as you know, functional medicine, we always mention, getting to the root cause. And that kind of started with my own journey. It was in 2008 as I quite frankly burned out completely from doing the traditional, conventional, what we call allopathic medicine. And at that point, I just was not getting people better. I was forever putting a Band-Aid on, or as we like to say, put the black tape over the engine light. And as so many of us, I had started down the path of looking at maybe there's a different way of doing this in my own family emergency of having a son diagnosed, being in the spectrum. And just saying I did not, looking, and I'm always one that's been kind of a rebel in that I'm always looking at, hey, is everything I've been told correct? And I think that's our greatest power, is to say, I don't know. I don't have all the answers with this one body of knowledge. Maybe there's a different way of looking at it. And so that son now is unrecognizable in almost every way as being in the spectrum.
That's amazing.
And just it changed my life. I think I always we like to think, oh, I changed my patients' lives, and but it really changed me being a functional medicine doctor, and started me on my own journey of health, but also spiritual growth, and learning that there's so much I don't know. I think the wonder of being in medicine and realizing there's so much. I'll never retire, Jenni. That's the beauty of it. It's I figured out, I found my art. I found the thing that I like to do because it's something new every day. Every day I learn something. So that's really been great.
Yes. Oh my gosh. And, you sound very similar to our story, and I say our as far as myself and my husband, Jake Berman. getting into treating problems and not symptoms in the functional world, because that's what kind of started our journey as my own health and getting, trying to figure out our own things. And we talk about it all the time on this podcast, is question every doctor you have, even us. If we're your provider, question us and ask us why we're doing the things we're doing. Is there another way? And as you said, just continuing to evolve and learn. Part of functional medicine is having the opportunity to do the research and to learn more and to find another way. So just being involved in this area is life-changing. So you started your practice, or really getting into functional medicine, for your own family health and for your own health, but now you've evolved to really helping tons and tons of people as far as finding other answers for their issues. But something you love is gut health.
Yeah, I mean, I think, I tend to be, I say it in my kind of my mission statement. I try to make the complex simple. And I think that's where we get a little off base sometimes in functional medicine, not to be critical, but just to say we tend to make the complex more complex.
Yes, I could understand.
And so we can get lost, what I call going down rabbit holes. And these rabbit holes end up being, it's about mitochondrial health. And it very much is. I'm into mitochondrial health too. And it's about, all of these hormones going on. And then it's the immune system. And it's true. And I've gone down all the rabbit holes. And that's the beauty of having done this for 15 years, is that now I can back up and try to see the 30,000-foot view. And to answer your question about gut health, that really, and I think all the great philosophers in medicine and all the great doctors in medicine, starting with Hippocrates, always came back to the same realization that I have, is that it all starts in the gut. And really the reason being is that's where our immune system's at. That's where our energy intake's at. That's where we, absorb the amino acids that make up our neurotransmitters. That's where we send signals through this big old vagal nerve to tell our bodies to be in a parasympathetic, which is where we need to be most of the time, state, versus a sympathetic state. And if we can affect the bacteria, which is really where we're going in medicine, and it's funny to see the traditional docs all going, it's all about the bacteria. And we've been talking about it for 20 plus years in functional medicine, if not a lot longer. But if we can affect our gut health, we can affect everything else. And that's kind of where my success lies, in that I'd never really do anything with my patients until I affect that gut health. And with that I've changed their immune system. I've changed their mood. And I say there's no specialties in functional medicine. I think we need to get away from us specializing in this, because functional medicine, if it's practiced correctly, everything's connected. So how can you have a specialty?
Right.
But that's my foundation. And I think any functional medicine doc knows that if they skip over that, they'll always, and I always came back to it when I first started, because I get down the rabbit hole. You have Lyme disease, or you have this, or you have that. And then I didn't fix their gut, and I would always fail. So
right. I mean, the gut is the second brain. That's something that's a statement that is said a lot. And it's like, well, what does that even mean? But if your gut is not healthy, you are not going to be able to treat XYZ symptoms or autoimmune disease or whatever your quote unquote diagnosis is, until we can actually fix our second brain. If our brain is functioning, that's awesome. But if our gut is unhealthy, the brain's not really doing what it's supposed to be doing. So we have to target that second brain, which is our gut.
Well, and I've even heard it said, Jenny, that it's our first brain. If we look at it from an evolutionary standpoint, that's really where everything started. And then we developed this thing on our shoulders. It is kind of fascinating that the brain, even with something, let's say, and this is a little more complex condition like mast cell activation, which is where people have a excess production of histamine and releasing all these cytokines. We know that starts in the gut. And actually, when those mast cells release, it goes through the enteric nervous system, which you have your own nervous system associated with the gut, and it feeds into the brain and causes histamine and all these nasty things to be released there. And if you don't stop it in the gut, then you can't stop it in the brain. You can do all you want, but if your gut is the origin source, then I'd like people to almost think about it as, if your brain's not working, it's because your first brain is not working, which is your gut. Then I can tell you, if I don't do the things I'm supposed to do from a diet perspective, I've got my own list of things I have to do. I suffer from, fatigue and lethargy and depression and things that I know aren't real, but I know where they're coming from. So
Right. And so let's go on that a little bit is, okay, now we know that the gut is the issue. So what is some of the workup that you're looking at as far as an individual's gut health? We mentioned in the very beginning that you're part of Pure Genomics, which for our listeners, Pure Genomics is a system in which we can understand the relationship between our genes, so our DNA, what we're made of, our genes, nutrition, and wellness. So is that something you utilize, or what's your general workup for overall gut health?
I think gut health, there is a polymorphism there that can tell you you're going to have an imbalance in bacteria called FUT2, and it's got a particular RS number. There's a lot of FUT2 polymorphisms, but I think that's probably the least of my concerns when I see a patient. And I tend to try. I grew up in the country, as you probably have been able to tell from my accent in Louisiana. And I kind of have. I've done all the testing, and I ended up treating people the exact same way almost every time. And so I said, I could save probably $1,000, $2,000 in all this testing if I just listen to the patient, and try to understand what their story is, where they've had their, where they breastfed, were they a C-section baby, were they on antibiotics for frequent otitis media when they were younger, which points to the fact that they probably have dairy sensitivity and they had, allergy type symptoms that were blocking their eustachian tubes. But as I listen to them and listen to how much stress they've had in their life, I can kind of determine what foods they eat to have problems with their gut. I can understand, do they have what we call SIBO, small intestinal bacterial overgrowth? How do we, and then I can do testing for that. But I'll tell you, being basic, healing the gut with glutamine and using spore biotics and probiotics and really using prebiotics, changing their diet so they have more fiber, more vegetables. I'm a big, I'll just tell you, I think everybody reacts to gluten. It's just to the extent that we all do. I think there's almost 100% reaction. It just depends on your other health markers, whether you can tolerate that or not, because it's not something that we're used to seeing, although we've been eating gluten for millennia. We don't prepare it the same way. So that's a big thing for me. And I remove the big two, which is for me, gluten and dairy. Mm-hmm. I look at healing the gut with things like glutamine, aloe vera, immunoglobulins if I need to. And I really do that for the first 6 to 8 weeks that I see somebody. Do I need a stool test to know that they're bacteria out of whack? I can talk to them. Do they have gas after they eat? Do they have irritable bowel type symptoms? Do they have reflux? Do they have yeast overgrowth? I can pretty much predict that. Now, I do use testing when I don't get success in that first 6 to 8 weeks. I'll go back and say, okay, we need to be more aggressive with this or that. Mm-hmm. But 95% of the time, I'm really not needing testing. So sorry, I went a little long there explaining that, but.
And that's great. It aligns with a lot of things that we talk about so frequently, how in general, gluten and dairy are more inflammatory food groups. And, we've talked several times about having the ability to turn genes on and off. And just as you mentioned, some of us may not react to gluten as much as others, but in general, all of us are reacting to some type of gluten or dairy. And we manifest it in different ways, and right. We may, show it 20 years from now, but we're already reacting to it.
There
And
you
as
go.
you mentioned too, gluten is changing every year in this country with how much it's modified. And that's why more and more of us are starting to become more reactive to it.
Yeah, well, if we could spend the whole podcast talking about this because I went
Right.
and did the research. I mean, I was so nerdy. I went back to 1876 looking at the papers on gluten, and the content was about 3% of the gluten was in wheat, right? And then we hybridized wheat, not genetically modified, but we hybridized it to become more glutinous. Because everybody likes the stretchy and the chewy. And, when we get really good pizza, it's about 31% gluten protein, which is unbelievable. But we quit letting bread rise. Sourdough done correctly almost has no gluten,
Right.
and when we look at the way we've done that, we're mass producing these things. We're putting wheat that's not had a chance to be broken down by bacteria and yeast and everything. And then we take emulsifiers, which are used to make the process even easier, and they create holes. But gluten in its pure form, in everyone, breaks down the gut barrier, and we have breakdown in zonulin, and we have leaky gut. So it's and I think that's Fasano's work out of Italy that really shows that most everybody responds to it. It's just the level which and how sensitive you are to your own body, and do you notice that? I very much notice that, but
Right. Right. And just knowing that you may not have GI symptoms to gluten, meaning
that's
the
right.
constipation or diarrhea, but you have the eczema or you're having the hair
There
loss
you
or the
go.
migraines, right? And a
You
lot of
nailed
times
it.
they don't
Yeah.
correlate that.
No, and that's the big thing. I think everybody thinks it's an irritable bowel thing. And I'd say 80% of my patients don't have any GI complaints
Right.
of gluten sensitivity. And it's usually brain complaints. It's usually eczema. It's usually, and they don't want to, that's the biggest issue I think I see in functional medicine is it's a great message. It's a great way of doing medicine, but it's such a personal responsibility. It's no pill I can give you to make you not gluten sensitive. I can only give you a lifestyle recommendation. And then if people are looking at functional medicine, they have to understand it's a partnership. I've had people just say, I can't do that. You're not what I was wanting. I'm like, what? Because I couldn't give you the magic pill. There is no magic pill because I have to have that partnership and I have to have that lifestyle change in the patient. And the ones that are willing to do it, it's just amazing. They've seen 15 doctors, and all I've done, Jenni, is change their lifestyle. And all of a sudden they're empowered and they now have control of their own health. And that's what we really are trying to do is I'm trying to teach them to fish, and I eventually want them to not have to see me anymore. They've already, got what they needed to make those changes. So.
Yeah, so let's even go there is how long do you think it takes before clients start to recognize a difference with being on plan as far as the gluten-free, dairy-free, taking the glutamine, the spore biotics, everybody wants a result yesterday. And it's something that we have to talk about continuously is healing takes time. I mean, when you sprain your ankle, it takes 6+ weeks for your ankle to get back to quote unquote normal for you to exercise. Your gut is not much different.
No, it's really not. And they say it takes 6 to 8 weeks to even begin to make the changes. But I've seen people have results pretty quick. Just by taking some of that inflammation. It's like that big bucket that we struggle with of I call it the bucket of inflammation. If you're not getting enough sleep, well, that adds to that bucket. And then you have a lot of stress, and that adds to that bucket of inflammation. And you're not eating correctly, that adds until it overflows into symptoms. But I think sometimes just removing some of those inflammatory foods, we can see some improvement, but we don't see a healed gut. Some people say it takes up to 6 months, and I think we can affect the change a little quicker than that. But I think our choices each day, the foods we put in our mouth, can make a huge difference in that process. But you're right, it's not overnight. And a lot of times I have people back in 6 to 8 weeks. I always wait 8 weeks, almost always, from that initial visit, because I know that it's going to take that long to see all the benefits, right? Or to see some of the benefits.
Right.
And so, yeah, I don't, and people will reach out to me 2 weeks after their first visit and say, I don't feel any different yet. I'm like, we're overcoming years. I mean, it's like you can't expect to, you've got a car traveling at 60 miles per hour or 100 miles per hour, and you don't have any brakes. You just, it's hard to change that momentum right away and turn that around, because you're in an inflammatory pattern.
Right. And the consistency behind it, they'll be like, well, I did really great all week, and then Friday night I ate 4 slices of glutinous pizza. And I'm
Yeah,
like, okay,
you
well,
just noticed yourself. Yeah.
so what's your take on one bite? There's research on just having one bite of gluten, or having even something as little as 500 micrograms of gluten when you have celiac disease can increase mortality rate. So what's your take on that one meal or that one bite that is off plan?
Well, when it comes to that, and I've seen, for some reason, it is a monster trigger food, and that even that one bite will set people back at least 3 or 4 days, if not much longer. I mean, it's really, I've been gluten-free since my son has, for 15 years, and I don't have to be quite as vigilant as I was before. I don't ever eat gluten intentionally, but I may get a little cross contamination here and there, and I do fine, because I'm very aware of my body now. I know the signs and symptoms. But when you're not aware of your signs and symptoms, and you do a week of being good, and then you do that slice of pizza, actually, that's my 6 to 8 week test on people. I'm like, all right, now go eat a piece of pizza. And I know that sounds crazy, but I want them to know how it makes them feel,
Right.
because it will mess them up for a while. But they need to make that correlation. This is why I feel the way I do. But yeah, it really is one of those things where the gut does not like it. It just doesn't. In my experience, I don't mean to be the anti-gluten doctor, but I kind of am. Just go ahead and embrace it. Yeah, but you're right. It affects, and especially in a celiac, I mean, it's really nasty. But it's a totally different pathway. It's a autoimmune pathway versus this innate immune pathway, which I think is just as bad for a lot of people.
Right. The inflammatory response. And, same thing when it comes to weight. I know we're not even talking about weight right now, but we'll have clients who are great 65% of their week, but then Friday night, Saturday, Sunday is a little bit off. That's 40+% of your week. That's going to make a big difference in the inflammatory response and the immune system and the metabolism. And the same thing, when it comes to the gut, is inflammation is not picky, right? It's going to stimulate, and it's going to stick around. And sometimes you won't even see the inflammatory response until 72 hours later, even.
Right. That's correct. And most people think, oh, I didn't have a problem with it. And I said, well, how did you feel 48 hours later? And the light bulb comes on, or 72 hours later. And it's like my wife, we've been doing it with my son and my whole family, really gluten-free. And she always says being gluten-free is like being pregnant. You can't be almost pregnant.
Right.
You are or you're not. So that's the kind of the key, because you are creating inflammation for a lot longer, and you're going to have symptoms. If I unintentionally get exposed, I mean, I'm 72 hours later still struggling with the symptoms that I have with it, which is all mental. I don't have any GI issues. I mean, I have all mental. So.
Mm-hmm. And that's the thing, is the reactions are different for everybody. And I know, celiac is completely different, but I like to use this example as I have celiac disease. My sister has celiac disease. My daughter has celiac disease. My sister gets migraines from it. I get GI upset. My daughter gets everything. I mean, she is emotional, GI issues, congestion, like just all of it. So just the symptoms that we get, all three having the same diagnoses, is totally different.
Exactly. And that's the funny thing about the body, Jenni, as I've learned, is everybody's got their own signaling pathway. The body is always trying to tell us something. Are we wise enough to understand, or do we have the language to understand what it's trying to tell us? And that's what functional medicine should be here for, is helping people understand what their body's trying to tell us. But I call them like our sentinel symptoms. And for me, I have an old turf toe injury, And that sucker flares up every time, and I get arthritis type symptoms if I get inflamed. So I know that's my sentinel symptoms, and my depression or anxiety is my sentinel symptoms, and they're not real. In my mind, they're not real because they're all associated with inflammation from my gut. But and then some people, just like you said, I think that's a great example of, you need to know what is your sentinel symptoms. What is it that your weak spot? I call it our weak spots, kind of like where our body, tends to give us more trouble.
Right. And so do you find that majority of the clients you're dealing with are coming to you for autoimmune issues? So autoimmune diagnoses?
I see, Jenny, I'm kind of one of those weird guys. I will not specialize because I love it all. I just tend, because I don't think there's any specialty there, but I do see a tremendous amount of autoimmune type conditions, MS, you name it, rheumatoid, these sort of things. And it really does all come back to the same dance, I call it. We're doing it, you go back to healing the gut, and you go back to calming down that what we call a Th2. Th2 is the type of immune response that's chronic inflammation and leads to Th17. And I can go into a bunch of nerdy stuff that nobody wants to hear about, but if we can affect that, which we affect it through our gut, and we can start shifting things over with resveratrol, curcumin, good fish oil. I mean, I'm talking about really good fish oils that are very clean, that aren't oxidized. These sort of things, we can stop that chronic inflammation, and we can stop we can start cleaning up the trash, because autoimmune disease is really based upon the fact that you're not cleaning up the trash, if you will, that from your immune system. And that's where you get benefit from resveratrol, curcumin, and fish oil, and some of these others that are so immune modulating.
Right. So it all comes down to essentially the same treatment, no matter what our title is and what we were told by Western medicine that we have. The treatment is really essentially the same, of healing your gut, reducing inflammation, removing the inflammatory process, and then replacing these vital amino acids for treatment.
Yeah, I mean, it really is all the same. And I've had I've seen miraculous things. And that's the beauty of what I do. It's a gift to me, is that I've seen truly things that Western medicine said, this is what you're going to have for the rest of your life. And that is not so. Do not become a diagnosis. Do not let medicine make you a diagnosis, because they don't understand that these things are reversible. That's the key word, is reversible. And I've had some unfortunate things where people show up and they're truly near death's door, and they have non-reversible conditions because it's so far deep that you just can't pull them out of that hole. And it's like a retirement account. You can't start expecting to put into a retirement account when you're 65 years old and retire the next year. You have to be putting in, the sooner you start putting into your health account, as I call it, the easier it is for things to be reversed. And, the sooner we can get a hold of things instead of being late in the progression, because there is damage at times, especially with the brain, that you can't show up with a progressive dementia and then expect, functional medicine to get you out of it. Now, if we catch it early and we understand what we're looking for, we definitely can reverse the causes of that. So,
right. Absolutely. I love that. And just, the ability to reverse these labels that are put on us. And the other side of it is, if mom and dad and aunt and uncle have this diagnosis and you carry the gene for it, doesn't mean that you have to have it. We have the ability to turn these genes on and off, and to, like you said, if we start putting into our health account in our teens and 20s and 30s, we can prevent that gene from turning on later on.
Well, my father had diabetes, he had high blood pressure, he had heart disease, he had all these things. And my blood pressure runs about 108/68. I eat all these things. My blood sugar is 85, I think, fasting. I don't have a fasting insulin above 5.2. All of these things, I didn't look at it and go, well, my dad's got it, I'm going to keep eating McDonald's and just wait for the medicine to fix it, because there's nothing I can do about it. And I'm I'm one of those that I'm very aggressive with. I don't believe in the family history being our destiny, of course. And I think functional medicine is about that, is even, things like ApoE4 that are associated with Alzheimer's, also has some benefits too. A lot of people don't realize that, but all of these things have some evolutionary benefit, or they wouldn't be there for a lot of us. But we just need to understand them and understand the genetics. And I've been studying genetics, as you mentioned at the first, for a long time. And I think you mentioned epigenetics. And I think that's really where we need to be focused, because it's really not about our genes. There was a study done in England, and they looked at 50 people and looked at their full genome, and like 4 of them weren't even supposed to be alive because of their mutations, not polymorphism, but mutations like life-ending mutations and heart defects. And they didn't have any of these things. And one had Turner syndrome, which is not supposed to be able to reproduce and have all these stigma. And that was a triple X chromosome. So it's kind of fascinating that person never even knew genetically that they were not supposed to be doing the things they were doing. So I think genetics are a very variable depending on our environment. We know that. So we exercise, we change our genetics right away. We get a good night's sleep, we change our genetics right away. We eat more plants and vegetables, we change our genetics right away. We change our microbiome. I mean, within 24 hours, we can change our microbiome by just what we put in our mouth. I mean, and our microbiome gives us the signals. So, we're big hotels. And whether we're going to be in a Ritz-Carlton or a little by the airport, motel. I'm not putting up anything. Anybody owns an airport motel, you can probably have a very nice one. I'm just saying. But I'm just saying it's the difference. We are, our whole thing is determined by what we put in our mouth, and our genetics are very much associated with that. And the other thing is and I've done like I say, I've been doing this 15 years, and I read a lot, and over I come back with exercise. I mean, movement is so important. Sleep is it's the basic things, the non-sexy things, but they are the linchpins of long-term health.
Right. And something, you can't just look at one area. We have to look at all these factors of the quality of sleep and the type of exercise and the hydration. I mean, are you drinking enough water? Because of the impacts it has on gut health. A lot of things people don't realize, like exercise helps with the motility of our gut health. If our gut isn't having that motility or the movement and passing the stool, then it's creating an environment for bad bacteria to grow. If it's not hydrated well, we're not passing our stool well, we get more gassy because gas bubbles are getting stuck between the stool and the bowel. So it's causing more pain, which is going to create an inflammatory response. So, but it's something silly of, are you drinking enough water during the day? That has the ability to turn these genes on and off. It's just amazing.
Yeah, it's the simple things. And that's a lot of times they struggle with that. They want it to be some magical concoction. And there's some really complex patients that I see that, I do have to get a lot more, into the weeds a little bit, but I'd say 90%, I would say 95% of the people that are listening to this can benefit from just the simple things. And the 5% is what I need to take care of, that are, chronically ill, and they've gotten so far in the hole that they really need a lot of help getting out. But yeah, it's all the things you mentioned, just even simple things like hydration and sleep. Oh my gosh, if I can draw any direct line besides exercise and diet, is the under how little sleep we're getting as Americans, and the direct correlation with every chronic disease and lack of sleep and the worsening of that condition. There's not one on the planet that you can show me that it doesn't get worse with lack of sleep. So yeah.
Right. And that's the one area of my life I continue to work on with a 7-month-old right now and a 3-year-old while running a business. And I say it all the time. I practice what I preach. The sleep is the hardest thing for me, just being able to get quality sleep and still get everything done in the day. But it's something that we continue to have to work at. And as long as we're recognizing the areas that we struggle, we can put more effort there, which is really important. And, a lot of times we don't even know where we're struggling because we're too subjective to treat ourselves. So having someone else to objectify it for you is really helpful.
Yeah, and that's where I have health coaches, I have clinical nutritionists, and I think that's been my strongest thing I've done is allow these patients to have someone that works with them gently and subjectively and objectively, and not try to do it all myself, but you do have to have that objective help. And I do think we all see ourselves so poorly. We have very little insight sometimes to ourselves, especially when it comes to health and the things we don't want to give up. And yeah, so having someone tell you this is an area you should focus on and bring awareness. So this is life, and philosophically, awareness is everything. Just being aware, being present to say, okay, this is what's happening with my body, and this is why. And someone has told me this is what's going on. So yeah, I think that's really important.
This is huge. Well, thank you so much for coming on and talking more about functional medicine and gut health, and just knowing that, whatever the diagnosis you've been giving or the symptoms we are experiencing, it all really comes back down to our gut health, or our first brain, as you called it, but second brain, as a lot of others call it. The gut has to be healthy for us to be able to progress and through life instead of regressing, but also to reverse these symptoms and autoimmune diseases that we've been labeled with. And not just the food, but the exercise component, the hydration, the amino acid replacement, which we didn't get a lot into today, as far as the things like glutamine and aloe vera that you were talking about, but certainly things we can have round two to talk about.
Well, and before we go, they've discovered, and I know this is a big topic now, is long COVID is largely determined by your gut health. And they're finally connecting that, which I think like I say, anybody who's been doing functional medicine knows that that's very intimately connected because it's inflammation oriented. But, even that now is, and part of the damage long COVID does is what it does to your gut. So, right. I think and there's so many ways to heal the gut. So many great things out there that do heal the gut naturally and supplement wise. And I think the time we're in the middle of the best research I've ever seen about that. And we finally got everybody on board. So I think I think it's a great message for everybody to take away is, this is where I need to start. And it's, even the vitamins we take, most of it's being utilized by the bacteria in our gut, the B vitamins, the vitamin D, all of these things are essential for our gut health because they are helping those bacteria. So.
Right. Yes, that's huge. And I love that you brought that into it, especially as we are entering, COVID's kind of ramping back up again. Flu season is here. As we're entering this, it all is going to come. Our immune system and the ability to fight these viruses or heal from these viruses is going to come down to how are we starting off? What is our gut health going into this season of life?
That's right. You're 100% correct. And that's a great message for everyone to take away, is that it really does affect everything else. And nothing's in isolation. Nothing is in isolation. Everything is connected. You can't say my brain's different than my kidneys is different than my gut. It's all the same. We're all working. It's one big, beautiful organism, I might say, but.
Absolutely. Well, thank you so much. We really appreciate you coming on. This has been a great conversation. We'd love to have another one and,
I would love that. Yeah.
Go forward with this, just continuing to help one more person by doing the alternative, getting that second opinion and really going internal.
Stick it to regular medicine. Start healing yourself. It's great. And they won't make millions on you. And that's the way I get back at the system is one person better is one way of we can cut so many things out of our society, the burdens of our society. So this is our way of getting back at I call it conventional medicine by just getting healthy, by taking responsibility for our own health.
That's it. Invest in your own health. It's an investment, but a long-term, something that's going to be positive long-term. So.
Yeah.
Well, everybody have a great week. Thank you for joining the Berman Method Podcast, where we are focused on treating problems and not symptoms for the wellness side, specifically healing your insides and getting you off of medications. Subscribe to us, email us, comment. Definitely check out Dr. Nathan Morris. He is in Colorado. He is just phenomenal as far as the functional medicine world goes. So thank you again for joining. Everybody have a great week, and we will see you next time. Ciao for now.
Thank you for subscribing on your social media and podcast platforms to the Berman Method. Dr. Jake Berman with Berman Physical Therapy and Jenni Berman, Physician Assistant with Berman Health and Wellness. You can find more information on our website, www.bermanpt.com for physical therapy, bermanpt.com/wellness for the health and wellness. You can also find us on social media, Facebook, Instagram, and on your podcast platform. So be sure to follow us, like us, subscribe to us. And if you would like any further information, definitely visit our website and reach out to us. You may also find our free reports on the websites as well, where you can download this free information for yourself. Have a great day.